I think there's been a lot of good kind of adaptions since the pandemic. Like, where can we meet people where they're at? There's still a need, We were still going in homes until I think our state was in red or the county was in red. But otherwise, we were still going in homes and putting all these safeguards in place, being on the front porch, wearing not only a mask, but like a shield. And it was interesting.
In camp chairs?
In our little camp chairs or stools, like as one of my clinicians would say, because it was this big, and he's a big dude. But I think the hybrid version of telehealth is good too, having the mix of in-person and also the availability to do telehealth, especially not only for kids and parents, but also for some professionals that really need it, that work a 10-hour day and want to prioritize their mental health. So I like the hybrid, I think, version of doing that. And I think with having some flexibility and hopefully keeping that, I know it can be a challenge with certain insurances to keep telehealth. And again, that is removed from the provider and the patient and put in the company, which I don't understand with the insurance company who aren't seeing the patient. So another red tape kind of flaw.
Oh, we've got a huge issue right now nationally.
Yeah.
The Four Walls Law. The Four Walls Law that is a, telehealth regulation from the 70s. Who even knew we needed telehealth regulations in the 70s?
Yeah.
Suspended during the pandemic through the emergency executive order. Addressed for Medicare population. So someone knew it existed because they fixed it for our Medicare populations, but they didn't address it for our Medicaid populations. And that irks me, because what's the difference between Medicare and Medicaid, right? Usually socioeconomic status, usually other personal intersecting factors. Medicare will all, if it still exists, will all qualify for someday, right? Medicaid, there's a different constellation of features that creates accessibility there. And so we addressed it for one population nationally, but somehow we forgot to address it for another population. So now I am the president of Pennsylvania Counseling Services, turning away 300 clients per week. And we started a telehealth clinic to reduce that number.
Right.
We started a telehealth clinic, not because everyone's like, I love telehealth, but because I can post a telehealth job. And if I do it Friday, I have 300 applicants by Monday morning. If I post a family-based job or an in-clinic role, it sits for a while, and then maybe I get an applicant and they don't meet any of the qualifications, but God love them. I still can't hire them, but God love them and their desire to do it. And I can't. And the Four Walls Law is just sitting there, and we've been told, like, don't fire people, don't stop, but don't grow.
Right.
And so that's what we're doing. We're not growing, but the need is continuing to grow. And we're holding and we're waiting while, like, our systems of care are rewriting. Essentially, we're going to have to make a massive shift in terms of creating mobile treatment centers and all these different things, instead of, like, just address the problem, address the law and the inequity. But essentially, like, the people who made the law, which this is a really common issue, the people who made the law, made the reg, are like, we have no agency here. And it's like, then what function do you serve?
Exactly.
If you have no agency in the space in which you govern, why are my tax dollars paying your salary? And so that's extremely frustrating to me. As we are met with this inequity, as we are met with these challenges, we don't, for some reason, we have helplessness that comes next. And I don't totally understand why.
And some companies may be handling it completely different too, and maybe continuing to grow. And
They are, for sure.
And then we may lose other agencies doing that because they kept growing, and then they're going to have to, who knows what's going to happen. But the Four Walls Law, I think, alerted a lot of people I know, and going into talking in colleges and universities, graduate level students are very aware of this, very upset about this as they're investing so much money into their education and then their license and then their supervision, and then to be caught with more of these barriers. Not only whether the provider has to be within four walls or the patient, it's got to be one or the other.
Yes.
So that's the issue. So, even if I have a confidential office set up, not in the actual licensed clinic, that isn't a four wall, and that would mean then my patient would have to come into one of our licensed facilities to do therapy. So more barriers. And why? Again, what's
the function?
Yeah,
what does it help?
Yeah, we're still being managed, and we're still abiding by all regs and notes and billing. It's just more red tape to further put barriers in the way of mental health when there's already so much stigma to it. So it is very frustrating, and I know a lot of people are really concerned about four walls. I know we had a discussion about it. I alerted some of my friends up in the Senate and the House, and I know, certain committees are looking at it, but I'm not sure how educated they all are or the impact of how many patients and providers.
Happy to come educate them.
If
they want to talk. Let me know.
I'll send you some names.
Yeah. And we do, but we write to these folks, and we reach out, we try to get activation.
Yeah, you have your lobbyists in place. The providers, we have lobbyists in place to support what we're doing. I mean, we're up there trying to fight the fight. Yeah.
So our RCPA is one of our organizations we work with, and they pull together all of because on our own, right, providers, we're not great at this.
Right.
We provide services. We're not great at advocacy. We're not great at evoking change at times at the levels in which it needs to be evoked. We're great at holding up the floor while these guys figure it out, but we don't always have access to the other nor are our perspectives often welcome. Nor do they want to hear it sometimes. So there's often places where I'm like, hey, I'd be happy to talk to you about this. And they're like, no, we're good.
Unless we find that legislator or that bureaucrat it's hit close to home. Mm-hmm. And that's sad that we're seeking that. Mm-hmm. What is this, participant's background? What is their family? What are their interests? That's how it works.
Yeah.
It's a whole other strategy, but that's what we have to be very strategic about. And that with the advocacy that you do at Lebanon Family Health, and certainly the school district knows that, who our legislators are that are more passionate about education and, online schooling. Everybody knows those things.
Mm-hmm. And who does the four walls law hurt? Right?
The constituents.
The lower socioeconomic status, which are disproportionately Black and brown,
right,
in communities that disproportionately have accessibility issues to begin with, and the providers who serve them. Mm-hmm. And we lost a prescriber over the four walls law, which sure could use more prescribers now.
Mid-level prescriber. That's who we're all looking for. Yeah.
And we've lost, we haven't lost any direct care staff in terms of therapy providers, other than natural attrition, but then we're not growing that program either because we're waiting.
While the wait list is
growing.
While
the wait list is growing.